My name is Dr. Bruce Scott. I am the president of the Kentucky Medical Association and a practicing ear, nose, and throat physician in Louisville, Kentucky. Probably for most of you, you remember last year's flu season. Maybe you got the flu yourself, or a family member, or a friend, or a co-worker suffered through the virus. It's not surprising because last year was one of the worst years ever for the flu. In Kentucky, there were over 10,500 confirmed cases of influenza, and we lost over 325 Kentuckians due to the flu, and 5 of those were otherwise healthy children. In addition to that, 2018 happens to be the 100th year anniversary of the 1918 pandemic worldwide, where over a third of the world's population contracted influenza. There were over 675,000 deaths in America. And I'm told earlier by Ben Chandler that this is actually more deaths than during the bubonic plague. Yet, for many people, it seems that the influenza is an inconvenience and maybe not worth even going to get a shot for. And that's something that we want to stop. The Kentucky Medical Association has joined together with the Kentucky Foundation for Medical Care and the Foundation for a Healthy Kentucky to bring to you this campaign on Focus on the Flu. We're excited to announce this historic partnership in this campaign to attack this disease that is somewhat preventable and certainly something that we can help manage and mitigate. We're announcing a very simple campaign that has 3 steps. Get your shot, contact your doc, and stop the spread. And the first step is to get your shot. And that's probably the most effective step for most individuals. And we want to convince all Kentuckians that this is a safe and effective step for them to take to stop the spread of the flu. We have therefore decided that September 26th, next Wednesday, will be declared Get Your Shot Day in Kentucky. We're hoping that all Kentuckians across the state will get out and get their shot that day. Now, the Center for Disease Control in Atlanta recommends that everyone get their shot by the end of October, and preferably before the flu season starts in their individual community. So we're encouraging all Kentuckians to get out and get their shot. The KMA and the Kentucky Foundation for Medical Care have been making improving the health of Kentucky our mission for many years. Last year in 2017, we had the program Commit to Quit to try to help Kentuckians reduce their use of tobacco. Focus on the Flu is another activity to build on this momentum to be beneficial for all Kentuckians. It's my pleasure now to turn things over to Mr. Ben Chandler, the President and CEO of the Foundation for the Healthy Kentucky, to tell you more about our partnership and why focusing on the flu this year is essential. Ben.
Thank you, Dr. Scott. I appreciate that very much. Appreciate those words. We will, I think by the time we're finished, hopefully everybody will understand how crucial this issue is. Before I get started, I want to point out the public health directors here who have traveled from all over the Commonwealth of Kentucky to be with us today. A very impressive turnout, and I'm just as pleased and proud as I can be. Thank you, guys. At the Foundation for a Healthy Kentucky, we have a single focus, and that is improving the health of Kentuckians. We support policies that are known to achieve that goal, and that's why we're here today. The flu made more than 10,500 people sick in Kentucky last year. That's an epidemic level, and we want to keep that from happening in the next flu season. We know how to prevent the flu, and that's why we've joined this campaign with 3 simple messages. Get your shot, consult your doc, and stop the spread. We know that annual flu shots work. They are the first and best line of defense when it comes to fighting the flu. Nationwide, the flu vaccine prevents about 5 million people every year from getting the flu. They're inexpensive, they're easy to get, and they reduce the chances of getting the flu by as much as 60%. And even if you do even if you do get sick, you're going to have a lot easier time of it if you get the shot. We're not talking about just a miserable cough, fever, sore throat, and body aches. The flu can be deadly. Last year, the flu killed 325 people in Kentucky, including 5 children. The flu shot also helps protect your friends, family, colleagues, and others from getting the flu. And that's especially important for those who either have weakened immune systems themselves or who come in contact with people for whom the flu is very dangerous. The sad thing is, Kentuckians who live on very low incomes are more likely to have the kinds of chronic conditions that make them more vulnerable to serious flu complications. Yet vaccination rates vary significantly by income level. And overall, just 38% of Kentucky adults and 43.5% of children get their flu shots. That's not nearly enough. This low vaccination rate exacts a toll not only on our health, but also on our economy. Direct and indirect costs related to the flu totaled more than $352 million in Kentucky. They do that on average each and every year. So get your shot. If you do get flu symptoms, consult your doc, especially if you are at high risk for complications. That means young children, older adults, pregnant women, and people with chronic medical conditions. There are treatments that can help, and you don't want to end up in the hospital. Finally, stop the spread. No need to be a stoic because you're just putting others at risk. Stay home and do the things we were taught when we were kids. Wash your hands with soap and water a lot, many times a day, and cover your nose and mouth every time you cough and sneeze. Our goal with the Focus on Flu campaign is to prevent an epidemic flu season like we had last year. We all have to do our part. So, get your shot, consult your doc, and prevent the spread. And now I'd like to introduce Dr. Brent Wright, representing the Kentucky Foundation for Medical Care. Dr. Wright is Associate Dean for Rural Health Innovation at the University of Louisville, and also a member of the Foundation for Healthy Kentucky's Board of Directors. Brent.
Thank you, Ben. I want to thank everybody who's here today because you're here to help us focus on flu. As Ben mentioned, my name is Dr. Brent Wright, and I have the unique privilege of working with both the Kentucky Foundation for Medical Care and the Foundation for a Healthy Kentucky. Both organizations are excellent champions for public health in our state, and I'm very excited about their decision to work together for the Focus on Flu campaign for this year. Historically, Kentuckians suffer from poor outcomes related to influenza. As Mr. Chandler mentioned, just 38% of Kentucky adults and 43.5% of Kentucky children get their flu shots each year, despite the fact that the vaccine reduces the risk of infection by as much as 60% and can lessen symptoms. Vaccination is also extremely important to help our most vulnerable populations who cannot get the shot. Infants under 6 months of age, and those who are immune compromised. When a majority of a community is protected, those people benefit from herd immunity and are less likely to contract the virus, which can be much more deadly to them. Getting a flu shot has also never been easier. Your physician's office is a great place to start, but you can also receive a vaccine at many pharmacies, grocery stores, clinics, and local health departments. Focus on Flu has a link to the CDC's Flu Vaccine Finder tool available at www.kyma.org/flu, which can identify a location near you. As many of you are aware, flu has already begun across portions of our state. While there are many different strains of flu, the vaccine is updated annually to match the circulating viruses and protect against the 3 or 4 strains likely to be most prevalent. A common myth is getting the flu shot can give you the flu. And I'm here to tell you that that is absolutely false. Let me repeat that. A common myth is that getting the flu shot can give you the flu, and that is false. Flu vaccines are safe, and the vast majority of side effects pale in comparison to the risks of actually getting the flu. Getting your shot each year is the first step in protecting yourself and others from the flu. However, the second step in preparing for flu season is knowing who to call if you think you have the virus. If you find yourself suffering from fever, body aches, headaches, runny nose, chills, and cough, accompanied by the feeling that you feel like you've been hit by a Mack truck, there is a good chance that you may have influenza. Your best course of action is to consult with your doctor as soon as possible. Studies show that flu antiviral drugs work best when they are started within 2 days of getting sick. It is also extremely important to consult your physician if you are at high risk for complications from the flu, like young children and those with chronic health conditions or those 65 or older. Finally, much of the flu can be mitigated by taking simple steps to prevent the spread of the virus. Many of these actions are things we learned in elementary school, but they still hold true today for keeping yourself and those around you protected. Wash your hands frequently with soap and water. Cover your mouth, your nose when coughing and sneezing. Avoid touching your eyes, your nose, your mouth for spreading those respiratory droplets containing the flu. And if you do get sick, limit your contact with others. Be considerate. And also, take antiviral drugs if your doctor prescribes as appropriate. It is also recommended by the Centers for Disease Control to avoid contact with those until you have been afebrile or without fever for 24 hours. The messages of this campaign are simple and essential to preventing another deadly flu season in Kentucky. I'd now like to introduce Allison Adams, President of the Kentucky Health Departments Association. Thank you.
Thank you, Dr. White. I appreciate that. I'm here today to represent Kentucky's local public health department officials and welcome the opportunity to partner with the Foundation for a Healthy Kentucky, the Kentucky Medical Association, and the Foundation for Medical Health Care. We're looking for this partnership to improve the health of all Kentuckians. We want Kentuckians to have the most opportunity for health that they possibly can. The mission of public health is to prevent disease, promote wellness, and protect the public. And no matter the health issue at hand, we public health officials are true to our mission. In the cases of flu this year, to prevent the cases of flu, your local health department will be offering flu vaccinations and launch education and awareness campaigns to focus on the flu at the local level. Your local health department will be promoting wellness in that most everyone ages 6 months of age and older should get their flu shot wherever it is most convenient for them. And your local health department will be protecting the public by monitoring the number of confirmed flu cases in your area, and when necessary, convening and bringing partners together in order to slow and/or stop the spread of the flu. Today is very important for our local health departments. While our mission for public health and health department officials is to promote, protect, and prevent the spread of diseases, we can't do it alone. And bringing the partners together and having such statewide community partners and strong ones at that will help us stay true to our mission to keep Kentuckians as healthy and free from flu as we can. And so I am pleased today that we, the Kentucky Health Department Association, are joining forces with such strong statewide partners to protect all Kentuckians from the influenza virus this year. And again, thank you for the opportunity reaching out to local health departments. We appreciate that. Next up.
Well, thank everyone. Now we're going to literally roll up our sleeves and give this campaign a shot in the arm, if you will. As I'm going to ask Ben Chandler and my fellow physician Brent Wright to come up, and we're going to be joined actually by the Kentucky Department of Public Health Commissioner Dr. Jeff Howard, and the Cabinet for Health and Family Services Secretary Adam Meyer, as well as the Personnel Cabinet Secretary Thomas Stevens. And all of us are going to receive our flu shots here live with you guys all watching to show you just how straightforward, simple, painless, we hope, all of this is. The flu shots will be given today by Premise Health. Premise Health provides a broad range of services here in the Commonwealth, including that they staff the Personnel Cabinet's 5 work sites, Living Well health clinics for our state employees. The Kentucky Employee Health Plan is helping us with this campaign by offering free flu shots at the Frankfurt Health Benefit Fair on October 1st in the Kentucky State Office Building. In addition to that, all the Living Well clinic locations will be providing free flu vaccines to the Kentucky Employee Health Plan's members beginning October 2nd. I'd like to thank the Department of Public Health and the Premise team for helping us with this campaign and literally giving the campaign our shot in the arm. After we finish with our shots, we will be happy to take any questions that you all may have, and we want to thank everybody for being here today.
Ready to go. This is ironic because the folks who gave me my flu shot last year are here in the audience from Lincoln Trail, Sarah Jo Best's outfit. I'm used to getting my shot in public.
There you go. Hopefully no screaming, no crying.
Be gentle, sir. You need me to hold your hand, Tim? I think maybe so, Chad. I'm a little bit concerned. See, it's all done, and I smiled the whole way through.
Okay, and we even have special Band-Aids that say, "Focus on the flu," which we're all going to be wearing today. And then we're going to take some selfies, and we're going to put those on social media. And we're going to try to help spread this campaign and get the campaign started. In addition, on September 26th, we're going to ask people who get their shot to use a similar Band-Aid, and we're going to ask them to take a selfie and put that information on Twitter. You're generous. Speaking of running out, one of the common questions that people have is there going to be enough flu vaccine this year? We have all indications that there will be plenty of vaccine for all the Kentuckians to get immunized. That said, that's one of the other advantages of getting out and getting your shot early. In addition, there's no disadvantage to getting the shot early because we believe the vaccine will be effective for at least a year. So getting your shot early means you won't be the first person in your office or your family who contracts the flu. Hopefully you'll be one of the people who's protected early rather than one of the people who spread the flu to everybody in your work site. As you can see, the whole process takes just a minute or two. This is not a big inconvenience for anyone, and there really is minimal pain. Yeah, that's a problem. Can you repeat that comment about the health plan?
Oh, well,
Least painful
no.
thing in Frankfurt today.
I made the comment that that may be the least painful thing that happens to me in Frankfurt today.
You gonna do it, Allison? Oh, and Allison is a last-minute volunteer to get another shot as well.
I want my flu shot, but only like you gotta do that. It can't get any more convenient than this.
That's right. I think we should have offered one today at all the news meeting. I think that concludes our live demonstration. I want to thank all the participants and Premise Health for providing the shot. I would ask Dr. Wright and Ben Chandler to come back up, and let's see if we have any questions from the audience. And Allison, if you'll come back up as well in case there's any questions from the Public Health Department perspective. And we're happy to take any questions from anyone who has any questions in the audience with us today. Any questions from the media?
You said you've got enough food, there's enough serum this year for nobody to worry about finding any place that doesn't have it. You know, take care of the different flu vaccine for the flu that's going to be out there this year.
Well, you ask a couple different questions. Yes, we do believe we have enough flu vaccine available this year, but as I said, it is one of the advantages of getting out early and getting your flu shot early so you know that they had enough flu vaccine for you. One of the things that always is a question is the flu vaccine going to be effective? There was some criticism of last year's flu vaccine that it perhaps wasn't as effective as it could have been. And that is true to a certain extent. However, even last year's flu vaccine, we believe reduced your risk of getting the flu somewhere between 40 and 60%. In addition, even if you got a different strain of the flu, having gotten the vaccine lessened the severity of your illness, whether that was the length of your hospitalization or it was the likelihood of you being hospitalized and thankfully lowering the risk of you dying from the influenza. Now, we have reason to believe that this year's influenza vaccine will be more protective than last year's vaccine. Each year, the CDC works to try to recognize what are the most likely viral strains to be causing the flu this year and put that into the vaccine. Obviously, it's somewhat of a predictive process, and it's not always perfect, but regardless, it is still something that will help you lessen your risk of getting the flu and lessen the severity of the flu if you do contract the virus itself. Thank you. It's a good question. Flu shots are widely available and are covered by most insurance plans. In addition, as we talked about earlier, there are a number of free programs for flu shots. Many employers provide flu shots. Health departments provide flu shots. You can get flu shots from your physician, and it is a reasonable question for you to call and ask ahead of time. But whatever the cost is of the shot, think about the cost of getting the flu. The days you miss from work, the medications you're going to probably wind up taking, the inconvenience that you're going to have, and the pain and suffering that you're going to experience.
There's one more thing to add about the supply of the vaccine is people need to realize the importance of getting it before we have cases of flu, because it does take a couple of weeks for you to develop the immunity from the vaccine. So it's not, don't wait till we have cases of flu in Kentucky and to go get your flu shot. It's now is the time. We're recommending launching it on September 26th and going on through the first week of October, focusing on going in and wherever it's convenient for you to get the flu vaccine so you'll be protected when our rise in flu starts to go up in Kentucky, or hopefully it won't if we all get our flu vaccine.
Other questions? There's already flu activity been reported in Kentucky, so now is the time to go ahead and get your shot. But typically, the peak season is sometime around October, November. So that's why our campaign is September 26th. That's why the CDC recommends that you get the shot prior to the end of October. Now, that said, for anyone who procrastinates, getting the flu shot even after the end of October is still beneficial, as the flu season many times will continue into the spring of the year, and we've even seen cases late spring and summer of this year. So get your flu shot early, but if that doesn't work for you, still get your flu shot.
As people often say, you don't want to time the market. You don't want to try to time the flu. So it's good to go ahead and prepare now. That's why we want Focus on the Flu. That's why our Focus on the Flu Day to get your flu shot is at the end of September. We want you to be prepared, because as a community is prepared, there'll be less cases of flu, less spread of flu. So we're looking to protect not only patients, but we're looking to protect communities in the Commonwealth. Yes, of course, we want everyone to, who is capable of being immunized by the flu, to get the flu vaccine. We want to make sure that those individuals who are less than 6 months of age who aren't going to be getting the flu shot. We want to make sure that the populations that can be protected are protected, so the flu is not spread to those individuals less than 6 or those who are immunocompromised, people who can't mount a proper immune response to the flu vaccine, people with chronic illness, people who are elderly. Something that's not often considered is that with the flu, if you don't get a flu shot, you can be a carrier of the flu. So you can be out and about in your community, you can be a carrier of the flu, and you can be spreading flu virus while you're not feeling that you have the flu. So we feel like this is a great way to protect not only yourself, but those around you, and as the question alluded to, those who are most at risk, because we want to protect the team. You can think of getting the flu shot as a team approach. You want to keep those around you healthy. Don't play the flu game. Don't play the flu gamble of, it's not going to be so bad if I get the flu. Talk to people who get the flu and ask them if they wish they'd gotten the flu shot if they had not. In fact, I heard before we started, I heard someone in the audience say, you know, I didn't get the flu shot last year, and I wish I had. If you have one for me this year, I'll take it. So don't let those naysayers around you minimize the flu. The flu has serious consequences, and we're here to help focus on those. Thank you.
I want to reiterate something that Dr. Wright said earlier, and I don't know why this myth continues, but the vaccine is not a live virus. You cannot get the flu from the flu shot. And I don't know why, but that myth continues to be perpetuated within our communities. And that's not how you get the flu. You get yourself not to have the flu by getting the flu shot. Other questions?
Well, anyone can come to anywhere to get your flu vaccinations. At the health department, we have an opportunity for, and each health department has, call your local health department, I should say first, but all of us have the opportunity for the Vaccines for Children program, so children who are eligible to receive the flu vaccine can get that through the health department. What's great about the health department is it's usually where we're able to document that you have gotten your flu vaccine, and so it's an advantage to at least contact your health department to make sure if you did or didn't get your flu vaccine. But we focus on vaccines for children, and then some health departments, again, the cost varies, but we can help with a payer source as it relates to if you don't have an insurance that covers it, we are able to have a flat fee rate, and that does vary across health departments.
Next Wednesday, September 26th, we will also be partnering with Passport Health Plan and be down on the river on the Wednesday on the river and be pushing the flu shots at that time. In addition, we will be on Twitter with our Get Your Shot, Got My Shot Twitter account hashtag, and we'll also be active. We're also going to be premiering at that date our Common Myths About the Flu video, which will have physicians answering some of the common myths about the flu. And there will also be a physician live on Twitter who will answer patients and people's question about the flu. This is all part of our launch of Focus on the Flu. We thank you all for being here with us today to help us get Kentuckians to focus on the flu. Thank you.